Hello people, this is Kerry Anderson. Hope you all doing well. In today's video, I'll be talking about 3 sneaky reasons your A1C level fluctuates. So if you like the video related to my health, my way, I would like to request you all please do subscribe to the channel, hit the bell icon and give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. 3 sneaky reasons your A1C level fluctuate. When you have lived with type 2 diabetes for a while, you become a pro at managing your glucose level. You know that it's best to limit carb, exercise regularly, check other medication for possible interaction, and avoid drinking alcohol on an empty stomach. By now, you may be well attuned to how your day-to-day activities impact your blood glucose. So if you see a big shift in your A1C level that you can't explain, you might be surprised and frustrated. Sometimes things you may not even think about can affect your blood glucose, which can in turn lead to serious complications such as heart attack, kidney disease, blindness, or amputation. Learning to recognize behavior or circumstances that you don't normally associate with blood glucose fluctuation may help you prevent more serious problems now and in the future. The first one, misdiagnosis. If your once controlled A1C has spun out of control despite your best effort, it's possible you don't have diabetes type 2 at all. In fact, according to the American Diabetes Association, about 10% of people diagnosed with type 2 diabetes actually have latent autoimmune diabetes. The incidence is significantly higher for those under 35 years of age. About 25% of people in that age group have latent autoimmune diabetes. So, in a 2019 report, trusted source doctors noted that this diabetes is manageable with the same regime used by type 1 patient. The condition progresses slowly, but it ultimately does require insulin treatment if you have been successfully treated for type 2 diabetes for several years or more. A sudden change in your ability to manage your A1C levels might be a sign of diabetes, the latent autoimmune diabetes. It's worth taking the time to talk to your doctor about the issue. The second one, changes to your supplement regime. These days, it seems like every vitamin, mineral, and supplement on the market is a magic bullet for something. But some nutritional supplements can affect your A1C test and lead to an inaccurate test result. For example, according to a paper published in the Journal of Internal Medicine, trusted source, high level of vitamin E can falsely elevate A1C level. On the other hand, vitamin B12 and B9, also known as folic acid and folate, can falsely lower than vitamin C can do, either depending on whether your A1C test measures by electrophoresis, which can show a false increase, or by chromatography, which can return a false decrease. Always consult with your doctor or dietitian before making any substantial changes to the supplements you take. It's important to know that some prescription medications such as interferon alpha and ribavirin, that is Verazole, can impact A1C testing too. If you have been prescribed a medication that might affect your blood glucose level or the accuracy of your A1C test, your doctors or pharmacists should discuss this with you. The third one, major life events. Tests, especially chronic stress, can raise blood glucose level and increase insulin resistance. According to the American Diabetes Association, you may be able to recognize when you are under bad stress. You may also know that it elevates level of the hormones that in turn raise blood glucose. What you might not realize is that even the most positive life event can also be a source of stress. Your body does not know to differentiate the bad stress from the good. You may not think to associate happy, exciting times in your life with bad A1C result, but there could be a connection. Even the best life changes, a new love, a big promotion, or buying your dream home can lead to an increase in the hormones associated with stress. If you are experiencing major life changes, whether good or bad, it's important to practice good self-care. The American Diabetes Association suggests making time for stress relieving practices such as breathing exercise and physical activity. Keep this in mind and stay on top of your blood sugar proactively when major changes are on the horizon. The takeaway is, under most circumstances, type 2 diabetes can be well controlled with the good lifestyle choices and attention to our emotional well-being as well as medication. When your best efforts don't get the job done, look deeper. There are often little considered factors that can throw us out of balance. One, recognizing it risk, most of us can regain our equilibrium and be on the road to steady glucose levels. So that's all about the diabetes in this video. I hope you all liked it. So that's all. We will definitely meet in the next video with my another content. Hope you will take care of yourself. Stay home, stay safe. Take care. Bye bye.